Hello, nurses. This is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing and the NCLEX. Today's focus is on lecture number 3, 5 problems that affect cardiac. And this is a continuation of my cardiac lecture. All right, let's get into it. All right, so the first thing that we're going to focus on is the heart. And obviously, it's the heart, right? So, um, what's the 5 things? So, the first thing is electricity. So, electricity is a problem with conduction in the heart. And in the other lecture, I'm going to talk about the SA node going to the AV node through the bundle of His into the Purkinje fibers, which will then contract. If everything is functioning normal in the heart, we should see normal hemodynamics. And this should be good for perfusion. But if there's a problem in electricity, we're going to see a problem with perfusion. And once there's a problem with perfusion, there'll be a decreased level of consciousness. All right, moving on. The next thing we're going to look at is a problem with volume. Now, volume is the heart is okay. There's nothing wrong with the heart, but the problem is volume. So you're going to see normal normal reactions like increased heart rate and perfusion problems, because the problem is the volume is not there. The other problem is the heart. The heart's broken, okay, and that's either because of long-term valve problems, which caused a floppy heart, or it caused a big trophy heart, which causes decreased cardiac output and causes problems. So there's an actual structural problem with the heart. It's either because of valves or previous MIs. There's actual damage to this tissue. And so it's not pumping as well as it could be. The next thing that we're going to look at is there's a problem with output. And that could either be related to a valve problem, usually a aortic stenosis, or the problem is outside in the fingers and toes in the peripheral vascular space. And that could be either related to either peripheral vascular disease, claudication, and all those types of things. And then the last thing is running out of space, is the problem with perfusion. And that's usually related to the coronary arteries. And the issue is the heart isn't being pumped, and that's like an MI. Okay, so this is the principle. Whenever we're looking at the heart and we're looking at the heart assessment, we're looking at whenever the patient starts to show signs and symptoms of problems with the heart. Like those could either be decreased level of consciousness. Decreased level of consciousness is because of decreased perfusion. Do not give the person Alzheimer's, right? Especially in NCLEX questions. If you have decreased level of consciousness or confusion or restlessness, it's about perfusion. Well, most likely. And the way that works is that because the brain needs perfusion of a mean arterial pressure greater than 70 to 75. And that's interesting to note. Please see my mean arterial pressure lecture where I'll cover that a little bit more closely. But always remember that when we're looking at the heart, there's 5 problems that will affect the cardiac, and it's usually these underlying causes. Either electricity, there's a volume problem, there's an actual structural problem wrong with the heart, or there's a pumping problem, or there's an actual there's a blockage of some sort that is like an MI or a clot or something like that. Well, that's about it for the first 5 problems, and we're going to explore these a little bit more closely. But first, we're going to talk about how does a person end up getting to each of these things. We're going to break down each one individually and then go from there. My name is Camp, and this is Nursing Camp. You can find me on Instagram, Facebook, Pinterest, and Etsy, as well as nursingkamp.com as Nursing Camp. And that's a bit for me. So nurse on. We'll see you next lecture.